Hello, I'm Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. So how do you know if you're in labor? Well, I'm going to give you a few pointers, see if we can help you out with that. So if this is your first pregnancy, it's often a little bit confusing to know. And some important things to remember is usually you'll know for quite some time and be in labor for a while before it's actually time to deliver. So you have time to sort it out. Generally in the office, we check our patients to see how they're dilating around 38 weeks, sometimes 37, sometimes earlier, depending on what the situation is. To understand what a contraction is, you have to remember that your uterus is a muscle, okay? And like any muscle, it starts out soft. So if you want to know what it feels like, you can feel your own arm. Feel your arm, see how it feels soft, then make a muscle and feel again when it feels firm. That's what your uterus is like. So when you have a contraction, it gets firm, but like any muscle, it gets tired. So it can only stay contracted for about a minute, minute and a half. So 30 seconds to a minute and a half. So when you feel your whole belly getting tight, firmness, feels like maybe the baby's balling up, that's a contraction. One of the things that many women don't understand is it doesn't have to hurt. It can be just pressure or just tightening. It doesn't always hurt. It can certainly hurt and be uncomfortable, but that doesn't mean it doesn't count as a contraction if it doesn't hurt. On the other hand, when you're near the end of pregnancy, especially after 28 weeks, and especially in the last month, you can have all kinds of discomfort. You can have sharp stabbing pains, you can have backaches, you have swelling, a lot of discomfort that can last for a while. And the way to distinguish that from a contraction is the timing on how long it lasts. That helps you. When in doubt though, then that's what your support team is for. Your physician, the nurses, labor and delivery, contact, ask questions. And what you're looking for is contractions 5 minutes apart or less for a full hour. Drink some fluids, get some rest, take it easy, another hour, and it doesn't go away, that's when it's time to go in. Those are general guidelines. You need to get a tailored answer from your own physician with your own clinical circumstance. If your cervix is more dilated, if you've had fast labors before, so we're talking about the first one. For each subsequent pregnancy, usually the process goes sooner, but you have a little bit more information. You know, you've been there, you've done that. But even physicians, a good friend of mine, a physician, his wife, he had to deliver her on the freeway in San Francisco. So not everybody can know exactly when labor is, and that's why you get care, why you're followed at the end of the pregnancy. Also around 36 weeks, you might pass your mucus plug. That's a hint that you've been having contractions. That's what causes that. You might have a little bloody mucousy discharge. That's okay. Heavy bleeding, not okay. Period bleeding, not okay. But to have a little bit is all right, and that just means you're heading in the right direction. So those are some general guidelines for you. Certainly you should get more tailored information from your physician for your particular circumstance. I hope you found this useful and helpful, and please give us feedback. Thank you.